Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Hello, everyone. You're welcome to another edition of Early Intervention Matters podcast. And this is a podcast that hosts different topics relating to neurodiversity in children, but also extending to adult findings in adults and how to support families and carers of children with neurodiversity. I am Dr. Inyang Takon, a consultant pediatrician. I have been a pediatrician for over 30 years, some of which I practiced in Africa, and I've been practicing in the United Kingdom since 2001 till date. I've been able to have a broad knowledge of practicing across continents and seeing differences in presentations. So my day-to-day work in the last over 20 years has involved the assessment and management of children with various neurodevelopmental disorders. And this varies across a wide spectrum of conditions like ADHD, autism spectrum disorder, tic disorders, fetal alcohol spectrum disorder, and also seeing children with various pediatric behavioral conditions, some of which have behavioral and emotional and mental health conditions, some of which can coexist with neurodiverse conditions. So I've also been able to compare different presentations because you see children across board, you see children with different difficulties, and you begin to observe different patterns. I've learned a lot from seeing children across board, but I've also had the opportunity to interact with families across board. Now, I would like to mention that prior to coming to the United Kingdom, I practiced as a pediatrician in Africa, Nigeria specifically, and there neurodevelopmental conditions were not common at all. I would probably say that they were there, but we were not recognizing them. And when I look back at my practice, then can certainly say there were children that I now recognize actually would have met the criteria for this condition. So this just goes to say that the practice of neurodevelopmental disorders was actually not well developed during my time practicing in Nigeria. So when I came over to the United Kingdom, I did further studies, postgraduate studies, which opened my eyes a lot and gave me a lot more insight into understanding these behaviors. And as a result, I developed more interest. And I must say, it's a very fulfilling part of my career. And I'm really pleased that I took on this field of interest. So day to day in my practice, I practice in the east of England, in Hertfordshire, and this is a mixed population. So I see people from different areas. But one of the things I've noticed is that when I see families from minority, African origin, that what I've noticed is more of a hesitance to, one, recognize these conditions, or two, sometimes be defensive about the reason why the children are presenting that way. And there's also been limitations in how the parents understand or are acceptable of these disorders or assessments. There are times when parents have decided that they're not going for the assessment, but explaining why it's so important and what benefits the child would have from having this assessment. We've had parents refuse outright that they don't want to. We've seen people who in denial, saying that the child is actually doing well and that the child probably is not doing well in the clinic setting and that the child does well when they're at home. And this has limited the assessments for the children. And sometimes it's been quite difficult because you can actually see that some of these children would have done really well with that support if it was present, but actually the hesitancy of the parents actually taking on board having the child assessed has limited the child being able to progress with their education or other activities. So it's with this information and or observations that I felt that, children from the African setting or the minority population are somehow disadvantaged in certain scenarios where they are not accessing the help that they need to access. And that's why I felt that it's important to explore why parents feel this way. There's always a reason, why people are hesitant about accepting certain things. And how can we help break those barriers? I think for me in particular, I'm very keen on ensuring that every child has equitable access to receiving the support they want, and we should try and eliminate barriers that prevent this happening. So when I've been able to speak to some of the families just to explore the reason why they've held that position that they've held, and it's been quite interesting. Some of which I would say I recognize in the fact that having grown up in with that background, that you can understand why certain things happen. If we think about in the African setting, a lot of times children um, are expected to be quieter, not to be that exuberant or active in front of adults, and sometimes if they're overactive, they're cautioned by their parents verbally. So there's already that notion that, any child who is being overactive or exuberant or not behaving the way they should behave is naughty. So there is that connotation of that child's behavior is bad, as opposed to looking at what could be, be the explanation for that child's difference. So you have that at the background. You also have the fact that many times children are not expected to socialize in the same place where the adults are. So if a child comes in and is sitting with the adults, that sometimes is frowned upon. So the child is expected to go and be somewhere different. And then there's also the part that if if that family sometimes is wanting to explore what could be causing the problem or the differences, they sometimes get isolated by family members. In Africa, you do find a lot of interactions between generations, or not just Africa, but I'm using Africa as an example. Interaction between generations. So you have not just your immediate family having an opinion, but you have the extended family, the in-laws, the grandparents. And so other people are contributing to um, why, behavior modification in a child or disciplining a child. So when parents come up with thinking that there might be other reasons for that child's behavior, that's usually frowned upon by other family members. And I've certainly seen this in my clinic setting where I remember a family whose child had gone through an assessment process, but they were very hesitant about other family members being aware of that child's diagnosis because they would be isolated and they would be frowned upon by other family members. So you can imagine in a family where there might even be children who have had an assessment, other family members may never ever get to know what that child's diagnosis is. So you have all this kind of things that sometimes parents have to deal with in deciding, do I go for an assessment or don't I go for an assessment? You also have the community. So a lot of people from Africa or minority communities actually exist within a bigger community, and that might be their local community or might be the faith communities that they attend. What you do find is that a lot of people within faith communities, especially if they're strong members, might hold opinions where they might see going for this assessment as being quite contrary to their beliefs, and it's frowned upon by other people in that faith community. And this can be a very strong barrier to them going forward for those assessments. So you then see where a child within that community, first of all, may not be able to have their needs assessed because of some of these barriers that I've talked about. And sometimes when the assessments are done, obviously information has to be given from different settings. Sometimes the parents disagree with information being provided by schools. They might argue and think that they're being stigmatized by the school. So sometimes we've seen conflicts between parents and schools because they disagree with the school's report of their child's behavior. And also, when you have these assessments that have taken place, you might find that parents disagree with the outcome of the assessment and might say, oh, this doesn't represent the child. There was a situation once where a child had moved countries and the child had had an assessment in the country where they lived and actually been given a diagnosis. But when the child moved countries, they never informed the new school that the child already had a diagnosis. And so that school was then picking up that the child had differences and was neurodivergent, and they were quite concerned and wanted the child being assessed. Well, unfortunately, they never ever divulged that information. So it was in the process of going into assessment and trying to get information from previous setting. Obviously, that information was presented in a different language, not English. Well, it was during the interpretation of the previous information that it became obvious that this child had already had an assessment and had a diagnosis. What parents were presenting to the current school was not the right information. So that child couldn't get the help that they needed because the parents were always against it. So, what happens in this kind of scenarios where the child hasn't had the assessment or had the diagnosis is that things get harder for the children as they get older. As they move up in years, it becomes harder for them academically, it becomes harder for them socially, and they then become isolated. They don't have friends, they can't interact the way they should. They're not learning, they're falling behind. And what happens? The children then develop, um, additional problems such as mental health issues, anxiety, low mood, and you can then see the child spiraling down. You also have the difficulty that those children are actually quite vulnerable because they're so easily led, and therefore they might get into trouble that normally, if they had been having the support they needed, they wouldn't have gotten into that type of trouble. There's so many disadvantages from not getting a diagnosis. And that's what brings us to the topic today, which is that neurodiversity needs to be seen as an everyday conversation within the African family setting or African culture. We need to begin to have an open discourse about how neurodivergent people present and how it is not a taboo, it is not a disorder we should be running away from, but it is a difference that we need to accommodate within our, just like that you have families with different people. We're not all the same in family settings. As parents, when you have children, not all your children are the same. We need to be able to celebrate the neurodivergent child just like you celebrate the neurotypical child. When we begin to have that open conversation about how neurodiversity needs to be normalized within our culture on a day-to-day basis, then it becomes part of us. Then it becomes the situation that we don't need to be defensive. We don't need to be anxious. We don't need to avoid or be in denial, but we will be trying to seek whatever support we can have for that neurodivergent child to be able to function within the society. So, what do we mean by neurodiversity? So, neurodiversity just means it's a spectrum of differences, and those differences can be obvious from the way we do things, our behaviors, the way we socialize, the way we're able to attend to things, how we integrate within society. But those differences are all originate from the way our brains are wired. So when we talk about wiring, we're talking about nerves, neurons. So our brains are made up of millions of neurons, and neurons are like wires that connect one to another, and they carry information from one end of the brain to the other. Now, the information the brain that the wires or the neurons carry depends on the areas of the brain that those wires are originating from. So there are different parts of the brain that help with different functions. There are parts that help with our attention. There are parts that help with our mood. There are parts that help us to be organized and plan things. So these wires are going across different parts of the brain. Sometimes there are differences in the ways those wires connect, and those differences, if the connections are not the way they should be, when things are working optimally well, you can have differences in the way information is transmitted, and this can affect all these areas I'm talking about. So neurodivergent people exhibit some differences in their behaviors than what you would expect from the usual developmental pattern. If you don't understand the differences in their behaviors, you can misinterpret them as just being naughty or rude, or just describe their behaviors in negative ways. And what happens when you describe behaviors in negative ways? The young person or the child feels that they're being picked on, they feel isolated, they feel they can't achieve. Whereas neurodivergent people are one of the most spontaneous and creative people. They have very bright ideas. They come up with some of the most amazing ideas. And for example, people with ADHD have been known to be quite spontaneous and creative. Some of them have been able to run very good and successful businesses, but they can do that effectively when you're able to support them, because when those functions are not well managed, then it can result in the negative aspect of things. So instead of being creative and productive, they can sometimes result in destructive behaviors because it's not well managed. So also people who are neurodivergent and have difficulties with socializing can be looked at as rude, and sometimes they can overreact because of anxiety or because of being overwhelmed in their environment. And if you don't support that, they find it very distressing and they can't cope. And what happens when you don't understand that these children are neurodivergent is you begin to feel that they're very rude and, obnoxious, and people begin to treat them differently. So we can see that there are different presentations. And if you look back at some of our previous episodes of the podcast series, we've been able to, in the last couple of episodes, and also the ones that we've done over the years, gone through some of these neurodivergent conditions. Early Intervention podcast actually started in September 2021. When the first episode was released. And I must say, we've been going for almost 4 years, but it's been very rewarding because we've been able to see that lots of people have tapped into these episodes. They've been able to download episodes from all over the world, which shows that people are seeking information. And that's what we want this platform to be, that people can come here and get information which would help them to make informed decisions. We've done episodes about ADHD, we've done episodes about the different gender differences and ADHD, particularly in girls. We've been able to look at the journey of a parent of a child with neurodiversity, going through those differences across regions. And particularly, I would say do listen to Izebua's interviews, part 1 to 3, because it actually showcases a lot of the challenges that families from neurodiverse backgrounds from the minority ethnic face. And you look at the challenges they face then and how they navigated that. I think the great thing about Izebua's series was that she's been able to overcome a lot of challenges, and I think a lot of families will learn from that. So I would really encourage you to listen to that. Then we had other series, which some of them would be released in the near future. We also had a series on anxiety. Now, anxiety is one of those very important things that I don't think we do justice to it. We hardly recognize when children are anxious, particularly in the African culture. Sometimes the child tells the parents that they're anxious, they get a negative response from the parents. They ask them why they're anxious, what's making them anxious, what do they have to be anxious, rather than being able to understand the child. So I would really encourage you to listen to that great series by Dr. Kate Fadaka. Dr. Kate Fadaka is a pediatrician and a psychiatrist, and she's also practiced in Nigeria before coming to the United Kingdom. She's got great experience and she gives some really, really useful pragmatic tips on managing anxiety, recognizing anxiety and managing anxiety. She also gives tips about how you can support your child with anxiety. And a lot of these past episodes also gives information on how you can liaise with schools, how you can work with schools, what services are present. We have some upcoming episodes which I would really implore you to come back and listen to. We've got an episode on speech and language difficulties and delay and how to support the child with speech and language issues. I would really implore you to listen to that. And we've also got an interview with an adult who has navigated the system, who has lived in African Nigeria and here, and who only recently got a diagnosis of autism spectrum disorder. You'll be able to learn from how she presented when she was younger, the challenges she felt, and what having a diagnosis has meant to her. I think when you listen to uh, DK's interview, I think it would help you to understand why diagnosis really matters. So there's a lot more to come, but we still have a lot of work to do. We have a lot of work to do. What we hope that we'll be able to achieve is that we'll be able to get more people in our community being empowered to seek help for their children. I have been in places, in communities, in different places where I've seen children who potentially have neurodiverse behaviors but haven't had the assessments and how their behaviors have been impacted and how their functioning has been impacted. And sometimes it's really difficult to have those conversations with families because sometimes you get oh, there's no problem, and that conversation is shut down immediately, or people offer different explanations to what may be going on. So even as a professional, it's sometimes quite difficult to get parents on board. But my take is you never give up, and it's about allowing parents to see that there is benefit in getting young people assessed and given the support. Like I always like using the analogy of if you need glasses, for example, you cannot see properly to do your work if you are not given those glasses. No matter how much you pray or talk about it or deny, that problem remains there until you deal with it. But when you've dealt with it and you've gotten the glasses, it's like you've got a whole new world. You can see properly. You can do those things. You don't fall over because you can see well now. You can see far ahead. You can plan what you want to do because you can see further. So that's the way it is with neurodiverse children. It's that you need to give them that support that they need to be able to be on the level playing field with other people. And so I just hope that you'll be able to get snippets of why we need to be normalizing the conversation around neurodiversity. So one other thing I wanted to touch on was in the course of my work, I've been fortunate to deal with young people of different ages and also been able to work with different agencies as well, which has involved working with social care, the police. I was once involved in the Royal College with drafting healthcare needs of children in the justice system. And was one of the things that has become obvious is that we have a lot of young people who are in the criminal justice system, so in prisons or some form of offending system, who have been picked up as having neurodiverse conditions. There are lots of them with ADHD and autism, fetal alcohol spectrum disorders. And what's been happening is that when you go back to look at the pattern in these young people, you discover that those behaviors had been going on at low level initially. But unfortunately, some of them were excluded from schools. Some of them were easily led to do things that on their own they would not have done. But because of the nature of their condition, they've been easily led by other people who have been able to pick up on their vulnerability, knowing that you suggest things to them, they do it. And unfortunately, they go and do it and they get caught and prosecuted and put in prison. When you get to know these young people and you then find out the pattern that has occurred over the years, some of them have gone on to have an assessment and some of them have been fortunate enough to get treated and have turned around. Not many of them are that lucky. And I would say that there's so many more who've been unlucky, who are in the system, have never been able to get an assessment and a diagnosis. So this is one of the reasons why we focus on picking up these symptoms early and getting these children assessed so that you don't get to the point where the child gets to that level and ends up in the criminal justice system. Unfortunately, the school systems these days has little tolerance for keeping children who in their quote are misbehaving. So what happens? They send them out, they expel them, they exclude them. Many of them are permanently excluded. And what happens? They hang out. When they're not at school, they find the crowd they shouldn't be with, and then they get exposed to drugs, they get groomed and exploited. And sadly, we have so many of them having this outcome. And one of the things that we are trying to stress on this podcast is that picking up the children early is the most important thing. Don't be afraid or don't feel, this is not right, this is what you shouldn't be doing. One of the things we recognize as a barrier is that sometimes parents feel shame from the children when they have some of these behaviors. And we're not playing down the shame because it is real and we understand that sometimes the pressure on the families can be so much that it's better to just ignore it or avoid it rather than confront it, and we understand. But what we want to stress or appeal to families is that just taking a step back and thinking that what you're doing by getting that child the help they need is almost like an investment in that child's life, because we are not going to be with the child forever, but we can do the best that we can for that child whilst we're with the child so that they can get the assessment and the help they need to also give them a platform to function and live a better life as they grow older. Not giving them that access actually creates more problems for them as they grow older. And sometimes these are things that it might be so difficult to rectify as they get older. Whenever we see children with neurodiverse conditions, we go backwards to take the history about how that child was growing up. And most times, there are behaviors that were present in that child as they were growing up that have been present, which people did not take notice of, or people noticed and did not seek help for. So we're trying, having a child with neurodiversity can be something that parents don't feel like going out, don't feel like mixing with other people. They feel isolated. They can feel sometimes embarrassed when they're in public and the child is behaving in a different way, so they avoid making contact with people. There can be so many things that those parents feel at that time. But what we're trying to encourage you is that there's always help around the corner, and that the earlier that child is assessed, the earlier the interventions, the better for the child. I've been fortunate to see children from very young age to some of them who've gone to university and finished. And I've been fortunate to see children who have come in, couldn't speak, nonverbal, couldn't interact, very difficult behavior at the beginning, families struggling to cope, but being able to see some of those children doing so well that you can hardly recognize them by the time they're getting into adulthood. And for me, that's one of the most fulfilling part of my job, is that you've been able to support families through that process, in able to get children to get the help they need and function better and achieve their potential. So we are stressing again and again that early intervention matters. Early intervention matters. And that was the reason for the onset of this podcast and putting this podcast. It was to showcase to families that early intervention for children with neurodiversity matters a lot for their future, for their well-being, for their integration, for them being able to achieve their potential. And so I'm encouraging families listening to this, parents and carers, that it is so important that you look through, if you see differences in your child's behavior, look through and see whether these behaviors, suggestive of any of the conditions that we've talked about in the podcast series, or places that you've been signposted, or ask your child's minders or schools whether those behaviors are present there. And if they are present, would encourage you to seek help. And for example, in the United Kingdom, we would encourage you to ask your school to write down a supportive letter to list the behaviors in the child, so that you can take that to your GP and get a referral to the pediatricians, the developmental pediatricians, to assess your child. So again, early intervention matters a great deal. And I hope that this is a message that you will be able to take away from this podcast, that it's important to seek help early. Thank you. So I'd just like to mention that you may be listening to this and you may recognize that there is a friend or family member that you think might benefit from listening to this podcast, particularly the discussions today. Please feel free to share the link, because the aim is to get children supported and have interventions early. So please share the link with family members, friends whom you think will benefit from listening to this podcast. Thank you. As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.